Hi everyone, my name's Ed and I'm a junior doctor working down in the southwest, currently in acute medicine, and I graduated from the University of Birmingham back in 2017.
My name's Eliza. I'm also a doctor working down in the southwest, about to start dermatology training. I also graduated from Birmingham in 2019.
And we're actually husband and wife, that's why we're recording this together. So starting F1 is a really exciting time, but understandably it can also be a little bit nerve-wracking. But it is good, despite the negative stuff you see online. It is a really enjoyable time. I think the main obviously thing that people get nervous about is suddenly having responsibility and feeling out of your depth, and those are feelings that everyone's going to have. But despite what you're here, there are good support networks in place. F1s are well supported, and you're exactly where you should be. You passed your exams, you deserve to be that F1, and I promise you that will be fine in that respect. And it's even nice just to have a salary is a good thing after living off student finance. But the main thing is you have a purpose. You're finally actually doing the job you've been trained to do.
Yeah, I think in terms of starting F1, it's an exciting time because you spent 5+ years preparing for this. You're finally earning money, being an adult. I think my biggest anxiety before starting was actually the on-call shifts, and especially the kind of long days, long hours, and night shifts. I was really worried about how I'd actually stay awake and look after patients overnight. But obviously everyone does it, everyone's fine. You'll sort of settle into it, and coffee definitely helps. So
definitely. So navigating rotations, I'm sure most of you already know what this involves, but you'll have 6 4-month rotations across F1 and F2, covering medicine, surgery, probably a GP or a psych or community one. The main thing is don't worry about what you've got. If you really want to do cardiology and you haven't got a cardiology rotation, it's not going to make any difference. You may even find the one that you're least excited about may end up being your favourite just because of who you're working with, and some of the training opportunities you get. The clear benefits, the rotations, is it allows you to sample a few different things in certainly more detail than med school. But also, I think even if you're the least GP person of all time, having a flavour of GP, if you have that rotation, or of A&E or of surgery, it gives you a really good understanding of how different specialties work, and that will really benefit your career in the long run. The main obviously drawback is you can get really comfortable in a job after 4 months, and then suddenly you have to go back to sort of take a step back and learn simple things like where the store cupboard is, how to sort of manage that team's ward list kind of stuff. But again, the ward are all, you understand that you're rotating, and it is all fine in that respect.
Yeah, I agree. I think, rotational training can be really hard. And, every 4 months, if you're moving somewhere new, you're having to learn all over again who you're working with, where to get changed, where to store your lunch. But, as Ed said, there are definitely positives to it. I think in terms of my top tips, making a WhatsApp group early on with other juniors on that rotation can be really useful. It can help make you feel like you belong, you get to know colleagues, but also you can ask each other questions about the specialty, which can be really, really useful. I think another top tip is knowing early who to go to for your annual leave and your study leave, because, you're entitled to it, you need to make sure you take it, and so get that sort of set in the calendar early on. It can also be useful to speak to other juniors, other F1s who've done that rotation. They might have some top tips that can make it a little bit easier for you. And lastly, I think, ultimately you are in a training program, you're here to learn, and, you absolutely deserve to see some interesting things and learn on the job. So think about what you want to get out of your rotation, and make sure you ask your supervisor, how to arrange going to clinic, going to theatre, seeing some procedures. It can be difficult, but it's a training program. You're here to learn.
Perfect. So in regards to sort of general tips and advice for F1s, this is a short video. There are, we could lecture on for hours on sort of tips and things, but we're each going to give sort of 3 sort of quite short ones that we think might be helpful. So my first one is just to reiterate: be confident, within reason, clearly, but you are where you're meant to be. You've got through medical school, you've passed your exams. All medics struggle with imposter syndrome and feeling like they're not good enough, but you've done everything you need to be there, and you've earned it. So be confident in your actions, because I said you're exactly where you should be. Linked to that though, be polite still. So number 2 is be polite and really sort of try and get to know the people on your ward or your clinical area if it's something like A&E. everyone will always want to help you, but if they sort of get to know you a little bit better, it will make it easier. And just remember that a lot of the sort of senior doctors or the nurses and physios, healthcare assistants, they're probably not rotating in the same way. So they've been doing that specialty for in some cases many years, or been on that ward for a long time. They know how things work. They can be really helpful, and just being polite and remembering that is gonna take you a long way. And they're obviously used to seeing rotating doctors come through. So appreciating it can be a bit frustrating for them when they've sort of trained up some over 4 months and suddenly they get some new ones again. So just be polite and be aware of that, and that will really help. And then my third little thing is just in relation to sort of a sport or a hobby or anything that you like doing that maybe you've done at med school and clearly there's more opportunities, is try and keep that going through F1. I think for hockey, I was like, I'll pause it and then, think about at Christmas whether I've got time. And then I didn't come back to hockey for 4 years, and I really regretted that. I think particularly just for sort of mental health, if there's something you really enjoy, try and keep it going. You're probably not going to be able to make every session or training session or practice session or meeting, whatever it might be. But just as much as you can, try and make an effort, because you'll be really grateful to hold on to it, and it really just will help your quality of life.
So that's, I agree with everything there. I think my top tips for starting, it's a stressful time and everyone deals with anxiety and stress differently, but it's really important to reach out to friends, family, other F1s. Everyone is going through the same process as you and probably feels exactly the same way. And obviously, support organisations both through your trust, but also Doctors in Distress and other organisations are really useful. We've already touched on this earlier on, but I think my second tip is it can be really daunting comparing yourself to other F1s and also other more experienced trainees like SHOs and Reggers, and you're thinking, oh my goodness, they know so much more than me, I'm not good enough, I shouldn't be here. But you are where you're meant to be. It's not a race. You will progress, and it's definitely worth it. Play the long game. And I think finally, it doesn't really hurt to think about the future, and it's a busy time, busy rota, but it can be useful just doing little bits here and there. If you think you might be interested in something, doing an audit and doing little bits to build up your portfolio can be really useful and help you out in the long run.
Awesome. So hopefully some of that is helpful. I said there are thousands of you all in the same boat in that mixture of excitement and nerves. And as I keep saying, you're exactly where you're supposed to be. You've trained for it. You deserve it. You've earned the right to be it. And there is some negativity around medicine at the moment, but it is a really exciting career. So good luck. I'm sure you're going to smash it.